Hello, my name is Greg Hanch, and I serve as the Executive Director of NAMI Texas. Thank you for taking time out of your day to learn about NAMI Texas. The National Alliance on Mental Illness of Texas, or NAMI Texas, is a 501c3 nonprofit organization founded by volunteers in 1984. NAMI Texas is affiliated with the National Alliance on Mental Illness, part of the nation's largest grassroots mental health organization. We have 27 local affiliates and nearly 2,000 members throughout the state. Most of our members are individuals living with mental illness, family members, friends, and professionals. Our purpose is to help improve the lives of people affected by mental illness. We do that through education, support, and advocacy. NAMI Texas envisions a state in which all people affected by mental illness receive services and supports to facilitate recovery. While retaining our grassroots values, NAMI Texas aims to become the most effective provider of mental health support and education opportunities, to dramatically grow our membership, to eliminate the stigma of mental illness, and to lead the way with successful mental health advocacy efforts. 1 in 5 adults experience mental illness each year. 1 in 20 adults experience serious mental illness each year. 1 in 6 youth aged 6 to 17 experience a mental health disorder each year. 50% of all lifetime mental illness begins by age 14. And 75% by age 24. And suicide is the second leading cause of death among people aged 10 to 34. NAMI Texas wants anyone who might have concerns for themselves or a loved one to know that they are not alone. We want people to know that mental health conditions do not discriminate based on race, color, gender, or identity. Anyone can experience the challenges of mental illness regardless of their background. However, background and identity can make access to mental health treatment much more difficult. We want anyone affected by mental illness, no matter their background, culture, ethnicity, or identity, to get the appropriate support and quality of care to live healthy and fulfilling lives. We want people to know that recovery is not only possible, but with access to care, recovery is probable. Recovery is a holistic process with many different dimensions of a person's life. These include health, home, purpose, and community. People in recovery have the tools to make progress towards their goals. People in recovery contribute to their communities. Stigma has led many to believe that people with mental illness will never achieve these positive outcomes. We are here to say with firm conviction that recovery is within reach and that a better life is possible. Our values at NAMI Texas include the value of hope. We believe in the possibility of recovery, wellness, and the potential in everyone. We believe in inclusion, in that we embrace diverse backgrounds, cultures, and perspectives. We believe in empowerment. We promote confidence, self-efficacy, and service to our mission. We believe in compassion. We practice respect, kindness, and empathy. And we believe in fairness. We fight for equity and justice. Recently, NAMI Texas announced our strategic plan for the next few years. We are focused on 5 pillars to achieve our vision. And these pillars are advocacy, awareness, financial strategies, affiliate support, and diversity, equity, and inclusion. Each of these pillars are supported by specific actions that take into consideration current public health factors, economic hardships, and recovery, as well as technological trends best suited to our target stakeholders. First, I'd like to address advocacy. NAMI Texas is perhaps best known in our community for our advocacy efforts within the mental health community. In the next 3 years, we will be implementing a series of initiatives to become the leading voice for change that improves the lives of those living with mental health conditions. Key initiatives that we have planned include hiring a policy director and building strategic partnerships with other mental health organizations that can further our vision and mission. In addition, we will continue representing our mental health constituents at the Texas legislature, focusing on a core set of policy priorities that are aligned with those of NAMI National. First, we will advocate for improved access to and quality of mental health care. We will advocate for addressing the experience of individuals with mental health conditions encountering barriers to care. We will promote policies that divert people from the criminal justice system and ensure access to services. And finally, we will focus advocacy efforts on upstream mental health interventions for children, youth, and adolescents. I'll next speak about NAMI Texas's mental health awareness efforts. As the needs of the Texas mental health community continue to grow, so does the complexity in the ways we communicate and engage with families and individuals to break down the stigma of mental health. In the next 3 years, NAMI Texas will broaden our reach via a broad use of channels targeted to consider how best to reach people in need of NAMI Texas services. NAMI Texas will focus on leveraging various social media channels and digital technology platforms. In the wake of COVID-19, NAMI Texas offered, for the first time in our history, online virtual mental health support groups. We want to continue to harness the power of technology and leverage other current social media platforms to reach out to peers and families in need. This pillar will work closely with our development committee. I'll next address NAMI Texas's efforts to diversify our financial strategies. Sustainability in operations and ability to expand our services is highly dependent upon the unrestricted and restricted funds that we raise each year. The COVID-19 global pandemic, racial unrest, and economic uncertainty have had a direct impact on mental health. Pandemics, isolation, and times of uncertainty can be stressful, as emphasized by the Centers for Disease Control and Prevention. We expect the demand for mental health services will continue to rise in the days to come. We expect COVID-19 to have a long-term mental health impact. In order to meet the demands of our community and to continue with our mental health policy advocacy efforts, diversifying our funding base will be critical. Over the next few years, NAMI Texas will be working towards increasing our individual donations, expanding foundation and corporate partnerships, and improving the philanthropic efforts of our local NAMI affiliates throughout the state. A development committee formed by our board members are leading these efforts. NAMI Texas also has a pillar in our strategic plan relating to affiliate support. NAMI Texas's vision is supported by an affiliate-driven operating model. Across Texas, we are able to serve the vast number of our communities with 27 affiliates, soon to be 28, spread out across the state of Texas. Over the course of the next 3 years, we will build upon our standards of excellence and incorporate the current needs and demands of our affiliates. NAMI Texas has formed an affiliate coalition of affiliate leadership across the state to develop leading practices in the areas of board leadership, fundraising, and programming. Initiatives including service level agreements on response times and minimal standards on signature programs and community events are in process as well. At NAMI, we believe that a diverse, inclusive, and equitable organization or alliance is one where all employees, volunteers, and members, regardless of gender, race, gender identity, ethnicity, national origin, age, sexual orientation, education, disability, veteran status, or other dimension of diversity, feel valued and respected. And this is the basic philosophy behind our strategic plan pillar relating to diversity, equity, and inclusion. We are committed to providing informed, authentic leadership for cultural equity and to modeling diversity and inclusion for the entire NAMI Alliance. We will, under this pillar, see that diversity, equity, and inclusion are connected to our mission and critical to ensuring the well-being of our staff and the NAMI Alliance we serve. We will identify and dismantle inequities within our policies, systems, programs, and services, and we will continually update and report organizational progress. We will explore potential underlying unquestioned assumptions that interfere with inclusiveness. We will continue to advocate for and support board-level thinking about how systemic inequities impact our organization's work and how to address that in a way that is consistent with our mission. We will practice and encourage transparent communication in all of our interactions. And we will lead with respect and tolerance. We expect all leaders and employees to embrace this notion and to express it in workplace interactions and through everyday practice. We are committed to a non-discriminatory approach and to providing equal opportunity for employment, participation, and advancement in all programs and work sites. In addition, we are implementing an evaluation and recruitment process to bring more diversity, equity, and inclusion across our board of director members. We will also be working with our affiliate coalition to determine how best to support our program offerings to underserved communities and diversity, equity, and inclusion sensitivities. I would now like to turn this presentation over to a colleague of mine, Patty Haynes, who is the NAMI Texas Program Director.
Thank you, Greg. Hello, my name is Patty Haynes. I am the Program Director of NAMI Texas, the National Alliance on Mental Illness. Education is an essential part of understanding and coping with mental health conditions. NAMI stands out among mental health organizations for our commitment to peer education programs. We train volunteers to lead classes, presentations, support groups, and a variety of community settings. Hundreds of thousands of people throughout the United States are touched by NAMI programs each year. Our programs change lives and reduce stigma. NAMI local affiliates throughout Texas provide numerous education programs addressing the many needs of different populations. There are several education programs for family members and friends of a loved one with a mental health condition. NAMI Family to Family is a free 8-week education course for families, partners, and friends of individuals with a mental health condition. The series of weekly classes are structured to help caregivers understand and support individuals with a mental health condition, and while they're maintaining their own well-being. We also have NAMI Homefront, which was developed to meet the unique needs of families of service members and veterans who live with a mental health condition. This is a free 6-session adaptation of the evidence-based NAMI Family to Family. NAMI Basics is a free 6-week education program specifically for parents and other caregivers of children and adolescents who have either been diagnosed with a mental health condition or who are experiencing symptoms but have not yet been diagnosed. NAMI Ending the Silence for Families is a 1-hour presentation for adults with middle or high school age youth that includes warning signs, facts, and statistics, how to talk with your child, and how to work with the school staff. Individuals living with a mental health condition, NAMI offers peer-to-peer. NAMI Peer-to-Peer is a free 8-week peer-led recovery education course open to any person with a mental health condition who wishes to live well in their recovery. The course offers a comprehensive understanding of mental health conditions with topics ranging from stigma to relapse prevention and also advocacy and much more. For community groups, NAMI offers Family and Friends, which is a 4-hour or 90 minutes seminar It informs and supports people who have loved ones with a mental health condition. Participants learn about diagnosis, treatment, recovery, communication strategies, crisis preparation, and also NAMI resources within their community. NAMI In Our Own Voice is a unique public education presentation that offers insight into the hope and recovery now possible for people with a mental health condition. Two trained individuals with a mental health condition lead a brief yet comprehensive and interactive presentation about mental illness. The presentation includes a video, personal testimony, and a discussion between the presenters and the audience. The testimonies put a face on mental illness while informing the audience of how people with a mental health condition recover and reclaim productive lives. Bridges to Hope. Because religion and spirituality often play a vital role in healing, it's not uncommon for families and individuals experiencing mental health issues to turn to a faith leader first for help. Yet faith leaders, staff, and key outreach volunteers are often lacking the information, education, and resources to be the bridge to hope needed as people navigate serious, sometimes life-threatening mental health issues. Bridges to Hope is a 3-hour mental health training featuring an informative overview of prevalent mental health myths and common symptoms of mental health disorders, along with simple ideas for building bridges to hope for your faith community. NAMI Smarts for Advocacy is a hands-on advocacy training program that helps people living with a mental health condition, friends, and family transform their passion and lived experience into skilled grassroots advocacy. NAMI affiliates throughout Texas provide regular support groups for individuals living with a mental health condition and for family members and friends of a loved one with a mental health condition. NAMI support groups offer participants an opportunity to share their experience and gain support from other attendees. NAMI Connection Recovery Support Group is a 90-minute recovery support group for people living with a mental health condition, in which people learn from each other's experience, sharing coping strategies, and offer each other encouragement and understanding. We also offer a support group for the LGBTQ+ community. NAMI Family Support Groups is a 90-minute support group for family members and loved ones of individuals living with a mental health condition. Family members and friends receive support from each other by sharing their experience, strength, and hope while caring for a loved one with a mental health condition. We also offer a support group for parents of children and adolescents with a mental health condition. There are also education programs for professionals. NAMI Provider offers a 15 or a 4-hour in-service training to line staff at public mental health agencies, and is taught by a trained 3 or 5-member team of family members, individuals with a mental health condition, and a mental health provider who is either a family member or an individual with a mental health condition. This course emphasizes the lived experience of mental health conditions, prepares staff members to practice a collaborative consumer, provider, family treatment team model care. NAMI Ending the Silence for School Staff is a 1-hour presentation for school staff members that include information about warning signs, facts, and statistics, how to approach students, and how to work with families. We also have NAMI Ending the Silence for Students, which is a 50-minute presentation designed for middle and high school students that includes warning signs, facts, and statistics, and how to get help for themselves or a friend. Parents and Teachers as Allies offers 2 hours of in-service training for Texas teachers and school professionals, helping them recognize and identify early onset mental health conditions in children and adolescents. Most NAMI education programs are also offered in Spanish to accommodate the many Hispanic communities throughout Texas. The following programs offered in Spanish are NAMI Family to Family, NAMI Basics, NAMI Peer-to-Peer, NAMI In Our Own Voice, NAMI Connection Recovery Support Groups, and NAMI family support groups. And for more information about the education programs that are offered throughout Texas, please visit our website, www.namitexas.org. www.namitexas.org. Now I'd like to introduce Matthew Lovett, our Peer Policy Fellow.
Hello, everyone. My name is Matthew Lovett, and I serve as a Peer Policy Fellow at NAMI Texas. In this role, I help to organize and execute state-level and grassroots advocacy to advance our policy priorities. More specifically, I develop bill language, conduct outreach with legislators and their staff, provide committee testimony during session, and collaborate with stakeholder organizations, including state agencies, coalition partners, and community groups to advance policies that improve access to services and supports for individuals living with mental illness. In other words, I'm an advocate. But let's zoom out real quick and talk about advocacy in general, and then zoom back in to discuss issues on which NAMI Texas advocates and how we accomplish our advocacy goals. First, what is advocacy? Broadly speaking, advocacy means to support or argue for a cause or a policy. Advocacy can include a wide range of activities, including organizing, educating, lobbying, and litigating. Generally speaking, organizing is gathering and unifying support to enact change. Educating is raising awareness and providing information to key stakeholders. Lobbying is working with policymakers in support of or opposition to specific legislation. And litigating is using the civil or criminal legal systems to fight against laws that contradict one's priorities. NAMI Texas doesn't participate in litigation, but we do organize, educate, and lobby. We'll discuss a few of the specific ways in which we conduct these activities in a few minutes. But for right now, suffice it to say that our primary goal in our advocacy is to improve access and availability of essential mental health care across Texas, and to empower affiliate members and their families to share their experiences and speak up for their needs. But why is this important? As I've alluded to, there exist serious inadequacies and inefficiencies in the mental health care system in Texas that impact people's ability to access care. In fact, according to the Mental Health America, in 2020, Texas ranked only ahead of Georgia in access to insurance, quality and cost of insurance, access to treatment, access to special education, and workforce availability. This can be seen in the group of states colored blue on the United States map on the left of this slide. Why is this though? Well, issues with access may be due to our leaders' prioritization of mental health services. The Kaiser Family Foundation reports that Texas is third to last in per capita spending on public mental health. Texas's per capita spending on mental health relative to the other states is shown on the map on the right. Or it could be associated with the social and cultural factors that influence our perception of mental illness and our willingness to seek treatment. Stigma, in other words. Also worth consideration is the impact certain mental illnesses have on a person's ability to recognize the need for treatment, which is common in more serious conditions such as schizophrenia. Whatever the cause, we believe these figures demonstrate the need for advocacy in the mental health space. Research suggests that 17.2% of Texans are living with a mental illness. If we take the estimate that our population is roughly 29 million, that means almost 5 million Texans may need mental health services. If a significant number of those 5 million people are unable to access care, it's easy to imagine the magnitude of the familial, occupational, educational, and economic impact that untreated mental illness is having on Texas and, more importantly, on Texans. What's worse is that the inadequacy of our mental health care system disproportionately impacts rural and remote parts of Texas, as well as for those who belong to historically underserved communities. These disparities in access to care can contribute to the widening gap in occupational and educational opportunities that are closely linked with economic well-being. Simply, individuals with mental health concerns who have ready access to care are better able to participate in their school and work to obtain a degree of stability and prosperity. So, advocacy. But we can't do it all. There are many facets to the mental health care system in Texas, and it would be a challenge to champion legislation in every issue area, which is why NAMI Texas surveys its affiliates and members to determine which concerns should take precedence in our advocacy. With their input, we've narrowed our focus to these 7 issues. First, early intervention covers a broad spectrum of issues that either improve or inhibit access to mental health services for adolescents and young adults, including access to services in school, specialized treatment for the first episode of serious mental illness, and issues related to the foster care system. With criminal justice, our policy work aims to divert individuals living with mental illness from the criminal justice system and, for those who are already justice involved, ensure that they are able to access the appropriate care while incarcerated or upon re-entry into the community. In the insurance coverage and medication access issue area, we work to expand access to insurance coverage, ensure that insurance consumers can easily and quickly obtain the appropriate mental health medications, and promote the integration of mental health services into the primary care setting. Our work in the housing and non-clinical support space seeks to fill gaps in the housing continuum for individuals living with mental illness, including providing more hospital step-down options, improving regulation of community-based group homes, and expanding access to affordable housing for individuals living with disabilities. Here, we also work to expand access to community-based occupational and academic supports. In the fifth category, mental health care system capacity, this category mostly relates to improving access to care by addressing workforce shortages, inconsistent broadband access, and burdensome regulations. Next, our work in the targeted populations space seeks to address inequities in the care that certain individuals and communities experience. For example, we work to address the use of conversion therapy on LGBTQ+ youth, reduce the barriers to care for low-income families, and enhance the services provided to veterans, new moms, and other groups with unique needs. And finally, with crisis services and suicide prevention, we work to increase awareness on the importance of training certain professionals on how to support individuals experiencing a mental health crisis, promote alternatives to a law enforcement response to a crisis, and streamline rules and regulations that pertain to access to crisis services. But what does this look like on a daily basis? What are we doing to accomplish our policy priorities? NAMI Texas participates in policy advocacy primarily in two ways. First, we engage the legislature in the development of policies that improve access to mental health services. This direct engagement in advocacy often includes developing bill language, sharing said bill language with policymakers, providing input on other mental health related policies, testifying in support or opposition to bills, and building stakeholder coalitions throughout the legislative process to help demonstrate the significance of a piece of legislation and the severity of the need it attempts to address. Although the legislative session only lasts 6 months every odd number year, this work is year-round and requires a significant amount of organization and collaboration to help ensure that our concerns are heard and addressed. The second form of policy advocacy we conduct is grassroots engagement, which includes training local advocates on how to share their experience with policymakers through the NAMI Smarts program, distributing action alerts to provide local advocates an opportunity to engage in the policy process, and developing and facilitating the state advocacy network to educate and support affiliate leaders and affiliate advocacy communities in their policy advocacy efforts. During the 87th session, we also organized a series of days of action wherein we connected over 150 advocates with their local policymakers to discuss the mental health concerns impacting their communities and provide potential policy solutions. The fourth day of action was preceded by a Capitol Day rally at which a few individuals living with mental illness, family members, and state legislators shared their stories living with or working on issues relating to mental health. It sounds like a lot, and it sometimes is. But considering the prevalence of mental illness in Texas and the impact of mental illness on Texans, the size and scope of our work has, over the years, significantly improved access to the appropriate mental health care for hundreds of thousands of Texans. Next up, we have Grace Mansfield, Community and Affiliate Outreach Coordinator.
Thank you, Matthew. As Matthew just said, my name is Grace and I serve as the Community and Affiliate Outreach Coordinator for NAMI Texas. And so my two main tasks within this role include working with local NAMI affiliates to expand their capacity and establish a NAMI presence in communities across Texas, and also provide support and services to our volunteers, participants, staff, and stakeholders. So some examples of how I help affiliates to expand their capacity includes recruiting and actively engaging community volunteers to serve as NAMI peer program leaders and ambassadors. I also set up regular communication with local NAMI affiliates throughout Texas. So this is done in several ways. We distribute weekly affiliate leader broadcast emails full of information on upcoming events and training opportunities, as well as useful leadership resources and tools. I also host monthly leadership calls and schedule one-on-one affiliate leader check-ins throughout the month as well. We also work with our affiliate leaders to help them plan strategic outreach initiatives such as trainings, events, promotions, and presentations. Additionally, we organize leadership development webinars that take place throughout the month of September every year. I'm also in charge of coordinating the development of new local NAMI affiliates. We call these groups startup groups. And startup groups are essentially working towards a NAMI affiliation. So it's a 5-phase process, and once they complete all 5 phases, they become an official NAMI affiliate in Texas. And each phase is intended to help them grow stronger so that they can better support themselves. And then lastly, providing support to affiliates can range from helping an affiliate organize and host a community outreach event, updating web pages and social media accounts, setting up new email addresses, ordering educational brochures, securing booths at a mental health fair, and recruiting and training new volunteers. So NAMI Texas currently has 27 affiliates and startup groups throughout Texas. And as you can see, these affiliates are throughout the entire state of Texas and are divided into different regions of Texas. And every region has at least one affiliate. These affiliates deliver vital mental health programs and support to their communities. NAMI's vision is supported by an affiliate-driven operating model. So in other words, we are able to support and fulfill our mission because of the leaders and volunteers of the affiliates throughout Texas. So while some of our affiliates in Texas do have paid staff, the majority of the individuals who help our affiliates thrive are unpaid volunteers. They are the lifeblood of NAMI, and the work that they do is absolutely critical in fulfilling the NAMI Texas mission. The leaders and volunteers of NAMI Texas provide free of charge education, programs, and support groups. So the leaders and volunteers within each affiliate get trained to become facilitators of the many different NAMI programs and support groups that NAMI Texas offers. They then provide those educational classes and support groups to their communities. And not only do many of the leaders of our Texas affiliates facilitate these NAMI support groups and educational classes, but they also take on the responsibility of finding new potential facilitators in their community. They offer mental health resources and referrals to community members. So the volunteers and staff of NAMI Texas affiliates answer emails and phone calls from their community members experiencing mental health crisis and provide them with the appropriate resources and referrals to their local mental health providers and organizations that can help. They offer hope and recovery, and they help spread awareness and reduce the stigma of mental illness. NAMI Texas affiliate leaders and volunteers help change the mental health conversation with education, awareness, and fundraising events throughout the year. They share their personal stories in their community, and they provide a community and support system for others navigating mental health challenges. Whether you are a peer with a mental health condition or a family member of someone with a mental health condition, NAMI Texas and our affiliates throughout the state are here to support you and remind you that you are not alone.